Through many years in the medical field, one truth has become undeniably clear. The worst health tragedies often begin with the smallest whispers from our bodies. Have you ever had that feeling that something isn't quite right? A fatigue that sleep won't fix, a subtle pain that just won't go away, a change you attribute to age or stress. Most of us ignore those signals and consider them normal, pressing forward in the hope that they'll resolve on their own. Yet reality repeatedly shows where that path leads. The opportunity for a cure can vanish within months, sometimes weeks, because a small signal was ignored. The right information at the right moment has the power to change destinies. That is why we will explore in this article 8 hidden physical warnings you should never ignore. These are not dramatic symptoms like those of a heart attack or stroke. They are silent messages, yellow flags your body raises to give you a chance to act before it is too late. Introduction. The body as an early warning system. Over more than 20 years of medical practice, one fundamental truth has emerged. The human body is the most sophisticated alarm system in existence. It is designed to survive and to communicate with us at every moment. The problem is that no one ever taught us how to translate its language. There is a fitting analogy that captures this truth well. The body first whispers. If you don't hear it, it speaks. If you keep ignoring it, it shouts. And if you persist, it forces you to listen. The following 8 warnings are those whispers. They are your golden opportunity to take back control. We will focus specifically on the symptoms of pancreatic cancer, sometimes called the silent killer, because its earliest signals are so subtle they are easily mistaken for minor passing complaints. Mortality rates for this type of cancer are very high, primarily because the disease is usually in an advanced stage by the time symptoms become impossible to ignore. However, early detection significantly improves treatment options and survival prospects. Important medical disclaimer. This content is strictly educational and informational in nature, and in no way replaces a consultation with a qualified medical professional. If you recognize any of these symptoms in yourself or a loved one, do not panic, but use this information as the push you need to contact your doctor as soon as possible. Doctor Warning 1. Subtle jaundice, a faint yellow tint in the eyes. The first warning is perhaps the most visible in principle, yet at the same time the easiest to dismiss in its early stages. Jaundice is the yellowing of the skin and the whites of the eyes. Many people picture a vivid cartoon-like yellow, but it never begins that way. The first whisper is far more subtle, a nearly imperceptible change in the whites of your eyes. You might notice it when you look in the mirror under natural light and think, "The whites of my eyes look a little dull, slightly off-white." Or someone close to you mentions it first. What is happening medically? The liver produces bile, a fluid containing a yellow pigment called bilirubin. This bile travels through a duct that passes directly through the head of the pancreas to reach the intestines and assist in digestion. When a small tumor grows in the head of the pancreas, it can press against and block this duct, much like stepping on a garden hose. The flow of bile stops, bilirubin accumulates in the blood, and because it is a pigment, it begins to stain the body's tissues from within. The first places this becomes visible are the whites of the eyes, and then the skin. Clinical significance. Tumors located in the head of the pancreas can produce this effect while still relatively small, which means jaundice can, in certain cases, serve as an early warning sign that opens the door to surgical intervention. Practical advice. Once a week, look at your eyes in a mirror under good natural light. If you notice that the whites have lost their brightness and appear yellowish or ivory-colored, do not ignore it. It is one of the clearest whispers your body can send you. Warning 2. Unexplained weight loss. When the scale drops on its own. The second warning is one that, sadly, many people celebrate at first. losing weight for no apparent reason. The numbers on the scale fall without dieting, without increased physical activity, and without any intention. From a medical standpoint, unexplained weight loss is one of the most significant red flags in medicine. We are not talking about a few pounds, but about losing more than 5% of total body weight over 6 to 12 months without a logical explanation. Why does this happen in pancreatic cancer? For two simultaneous reasons. Malabsorption. The pancreas produces vital digestive enzymes. When a tumor interferes with their function, the body becomes unable to absorb nutrients and calories properly. You may eat normally, yet the food passes through without being used, leading to malnutrition despite adequate intake. The tumor's energy consumption. The tumor itself consumes enormous amounts of energy to grow. This large caloric deficit, combined with malabsorption, rapidly burns through both fat and muscle tissue. We live in a culture obsessed with weight loss, which makes this signal particularly vulnerable to misinterpretation. But the body does not lose weight without a reason. If you are not eating less or exercising more deliberately, ask yourself, what is consuming that energy? Do not celebrate unexplained weight loss. Question it. Chapter 2. Warning. 3. Deceptive pain in the abdomen and back. The third warning is the most common and the most treacherous. It presents as a dull but persistent pain in the upper abdomen, often radiating toward the back. It is rarely sharp at first, more of a nagging discomfort, a sense of pressure that comes and goes. Most people dismiss it. Gas. I ate something heavy. It must be stress. And so months pass, taking antacids to suppress a symptom that is trying to get attention. The anatomical reason. The pancreas sits deep in the abdomen, directly in front of the spine, surrounded by a network of nerves. When a tumor grows in the body or tail of the pancreas, it can press against or invade those nerves, producing that persistent dull pain. A key diagnostic clue. The pain often worsens when lying on one's back and eases when leaning forward. This is because lying flat increases the pressure the tumor exerts on the nerves of the back. Some patients begin sleeping in a reclining chair to find relief, unaware that this behavior itself is a symptom worth reporting. The bottom line. Pain in the abdomen or back with no clear cause, that does not improve with rest and that shifts with changes in body position is not normal and should not simply be endured. It is a message from the body that something deep requires attention. Warning 4. Diabetes that appears out of nowhere. The fourth warning is one of the most important findings in the early detection of this disease. The sudden onset of diabetes, particularly in people over 50, or an unexplained abrupt worsening of previously well-controlled diabetes. Type 2 diabetes is typically associated with obesity, a sedentary lifestyle, and hereditary factors. But imagine a 60-year-old, active at a healthy weight with no family history of diabetes, who suddenly presents with extremely high blood sugar levels. That is an exceptional alarm requiring thorough investigation. The biological connection. The pancreas produces insulin, the hormone that allows sugar to enter the cells and supply them with energy. A tumor can destroy the cells that manufacture insulin, or it can release substances that cause the body to become resistant to it. In either case, the result is the same. Sugar accumulates in the blood. Numbers worth noting. Studies indicate that a significant proportion of pancreatic cancer patients, often between 1/3 and 1/2, develop diabetes as an early manifestation of the disease, sometimes 2 to 3 years before the cancer is diagnosed. This is an irreplaceable window of opportunity. The practical message. If you or someone over 50 is suddenly diagnosed with diabetes without the usual risk factors, or if you are already diabetic and notice a sudden unexplained deterioration in control, ask your doctor directly. Could there be another underlying cause for this? Should we examine the pancreas? A question that simple could save a life. A moment to reflect. We have discussed subtle changes in the eyes, in weight, in pain, and in blood sugar. If you have recognized any of these signals, know that the goal is not to cause alarm. It is to give you the power of knowledge, because knowledge is the fuel that enables timely action. Warning. 5. Abnormal digestive disturbances. The fifth warning is a cluster of very common digestive problems, and therefore the easiest to normalize. Persistent indigestion, bloating after eating, nausea, and feeling full very quickly before finishing a meal. Everyone experiences these occasionally, but the critical difference is when they become persistent and without a clear cause. Not the heaviness after a large celebratory dinner, but bloating after a light green salad. The explanation. The pancreas produces a mixture of enzymes to break down food. If a tumor blocks the pathways through which these enzymes are released, foods, especially fats, remain poorly digested in the stomach, fermenting and producing gas, bloating, and nausea. Additionally, as the tumor grows, it may press against the stomach itself, accelerating the sensation of fullness. Millions of people live with antacids permanently within reach. But if you notice a persistent change in your digestion, if you feel full too quickly or are constantly bloated for no discernible reason, do not rush to self-diagnose. This could be the pancreas whispering for help. Warning. 6. The fatigue that steals your life. The sixth warning is fatigue, but not the tiredness of a long workday. This is a deep, overwhelming exhaustion that does not improve with sleep. A depletion that makes the simplest daily tasks, such as showering, feel exhausting. This type of fatigue is common in cancer, but difficult to identify because it resembles the symptoms of stress or depression. The key is its relentless nature. Ordinary tiredness goes away after a restful weekend. Cancer-related fatigue does not. The reasons. The malnutrition discussed earlier deprives the body of the fuel it needs to function. The tumor itself consumes massive amounts of energy to grow. The immune system, exhausted from fighting the cancer, releases chemical substances that send extreme fatigue signals to the brain, much like what happens during a severe bout of flu. A clarifying analogy. Normal tiredness is like a phone battery at 10%. Charge it overnight and wake up to 100%. Cancer fatigue is like a battery that, no matter how long you charge it, never goes above 20%. You wake up already drained. Do not underestimate severe, persistent fatigue. Do not accept it as a natural part of getting older. If your energy has dropped sharply and rest is not restoring you, listen to that whisper. Your body is telling you that its reserves are being drained by something hidden. Warning 7. Messages in urine and stool. You must not ignore. The seventh warning is a subject many people feel embarrassed to discuss, yet the body sends critically important messages through these very channels. We are speaking of two changes that typically appear together: urine that becomes very dark, the color of tea or cognac; stool that becomes pale, clay or putty-colored, often greasy, floating, and difficult to flush, a condition known medically as steatorrhea. The explanation. These two changes are two sides of the same coin. Obstruction of the bile duct. Mentioned earlier, under normal circumstances, bile and its pigment reach the intestines and give stool its characteristic brown color. When a tumor blocks that duct, two things happen. Bile no longer reaches the intestines, so the stool loses its color and becomes pale. Bilirubin accumulates in the blood. The kidneys attempt to clear it by excreting it in urine, which then turns dark. The reason stool becomes greasy is that bile also plays a key role in fat digestion. When it fails to reach the intestines, dietary fat passes through undigested. Practical message. Please do not ignore what you see in the toilet. If you consistently notice dark urine in the absence of dehydration and/or pale, greasy stools, you are witnessing direct evidence of a problem in the biliary or pancreatic system. Report this to your doctor immediately. Tractor Warning 8. The itch that drives you mad. Generalized skin itching. The final warning is among the most unexpected and distressing. An intense itch that spreads across the entire body with no visible rash. This is not an insect bite. It is a persistent pruritus that can affect the whole body, intensifying on the palms of the hands and soles of the feet, and at times severe enough to prevent sleep. People attribute it to dry skin, soap sensitivity, or stress. They see dermatologists, try creams, take antihistamines, all to no avail. The cause. Once again, it comes down to obstruction of the bile duct. In addition to bilirubin, bile contains bile salts. When these accumulate in the blood, they deposit in the skin and irritate the nerve endings, producing an itch that emanates from within. This is precisely why topical skin creams typically provide no relief. The diagnostic lesson. Symptoms do not always appear at the site of the problem. A dysfunction in the pancreas can manifest as itching in the feet. If you are suffering from generalized treatment-resistant itching with no accompanying rash, look beyond the skin. Ask yourself whether it is accompanied by any of the other whispers described here. It may be a desperate signal from your body calling for help. Conclusion. 8 whispers in the language of the body. Together, we have translated 8 silent messages: a faint yellow tint in the whites of the eyes, unexplained weight loss, deceptive pain in the abdomen and back, sudden or unexplained onset of diabetes, persistent digestive disturbances, deep exhaustion unrelieved by rest, dark urine and pale, greasy stools, generalized skin itching without a rash. Each one in isolation may seem insignificant. Together, they tell a story. The story of a vital organ in distress. 3. A practical guide to taking action. Keeping this list in mind is not about living in fear, but about living with awareness and the capacity to act. Listening to your body is not hypochondria. It is proactive health management. When should you act? If you identify 2 or more of these symptoms persisting for more than 2 weeks, it is time to act. Do not wait. And if only one message from this guide stays with you, let it be this. The next time you feel one of these whispers, the next time your instinct tells you something is not right, please do not ignore it. Book an appointment with your doctor. Go armed with this information. Describe your symptoms clearly. That simple conversation could radically change your future. It could be the difference between a late diagnosis and an early detection. Your health is your greatest treasure. Guard it well. This content is educational and informational in nature. Please consult your qualified physician if you experience any of the symptoms described above.